I again would like to take this opportunity to thank the Foundation for putting this event on today. For so many of us in this room, we know how very important the social and emotional and mental health issues are with our children. And for all the educators in the room, if you raise your hand so we can see all the educators, we know that in a day that we have in a classroom with children, there's not always enough time to be able to pay close attention to those things that we'd like to pay attention to, and then take that information and share it with counselors and others in order to get assistance for kiddos that we have in our school districts. So we're always looking to be able to find new ideas and creative ways to partner together so that we can indeed meet the mental health needs of the children within our school districts. The Summit County Educational Center represents 16 public schools within Summit County. Some of those, 7 of them are local, 9 of them are city, and then we also partner with Akron Public. Now, Akron Public is one of the big urban 8, and because of their status, they work with us, but not as closely as the other 16 districts do with the Educational Service Center. The 16 districts, not including Akron Public, have 31,000 students that we see and work with daily. Now, those are old numbers because the EMIS data, for those of you also who are educators, has not come back to us yet, so those are last year's numbers. Akron Public themselves have close to 24,000 students. So when you add those two numbers together, you know that we're certainly over 50,000. And when the gentleman from PERC reported that within a year's time that they had seen close to 500 children, and if we think about those children as students, just think about the percentage then that number is of the kids that we have in Summit County. With regard to data, relating to the questions, and I too do not have a PowerPoint today, but data is a very important thing that drives all the decisions that we make in school districts. And we continue to look for ways to find different instruments to be able to identify the mental health issues that some of our kids might have. For a long period of time, we've been dealing with surveys that we report to ODE with regard to suspensions, expulsions, also with drug and alcohol issues with grants that we've had in the past from the federal government, and also school climate surveys. And those now have become a very important part of the Ohio improvement process that we're involved with at our ESC, and also many of the districts in this room and across the state. We have also, Mike tells me, developed a survey for students that has been used with a mental health survey that has been used for one of the districts that we're working with. And also with our early childhood department, they have also been developing a set of questions that they can ask children of younger ages. Our family and community partnerships continue to grow through school advisory groups, PTAs, and booster clubs. The ESC is partnering with the Family Children's First Council and Greenleaf and several school districts to write the competitive grant referred to by Dr. Bean earlier today. And by the way, you all can't go out and apply for that grant. It has to be between a Family First Council and an ESC, but you certainly can partner with those entities as they move forward. Only 25 of them, however, will be granted, and there are 56 ESCs within the state of Ohio. But through that, we hope to have a blueprint for school and family community engagement in Summit County that we can share at the state level as we move forward with House Bill 1. Our community partners, are working together in partnership and continue to do so to build collaborations. We, of course, have P16s Council here in Summit County, as there are in many of the other counties within the state. And under the leadership of Russ Pry, who is still with us, and so thank you for hanging in there with us this morning, and led by Family and Children's First Council, a think tank has come together to discuss the social, emotional, and health issues of children within our county. Social service agencies, Children's Hospital, Head Start, the Educational Service Center, and others are charged with providing a plan to Mr. Pry for implementation in the very near future. So we are very fortunate to have a leader such as Mr. Pry in our county who is looking at the needs of all the children and families in community within Summit County. So thank you for that. Today's conference is extremely exciting and gratifying. The efforts of everyone in attendance will help build a safe and nurturing environment for children. Having that background certainly with family and knowing as a teacher for many years the difficulties that many of these little ones face, and then through the leadership positions, listening to teachers and principals and superintendents, and when those kids come to us for expulsion hearings over things that you wonder, wow, how did they get here? And as opposed to expelling them, my goal was always to, how can we help them? I don't want to punish. There has to be something that's going on in this child's life. Let's find out what's going on. Let's find the ways that we can help and make that a priority instead of always punishing. So obviously, I'm here as an advocate for children and the mental health of children, and thank all of you for being here as well.